doesn't hurt.
Alright, knock, knock, knock.
Come in.
Alright, I'm washing my hands, providing for privacy. Hi, it's Emily again, your student nurse today till 4:30.
Hi,
I'm here
Emily.
to teach you about your injection of heparin.
Oh, okay.
Um,
Well, thank you. I'm eager to learn with you today, but I'm a little nervous because I've never given myself an injection at home before.
so you've never given an injection before?
Never.
Okay, alright, that's fine. That's something we can go through today. I also want to let you know that you need to check out for bruising with this medication. You're going to bruise a little bit more easily with this, but we'll get right in it, okay?
Sounds
I'm
good.
just going to make sure we have adequate lighting.
It looks bright in here,
Okay,
and there is also privacy.
alright. What are your concerns?
Well, I can't really see anymore, and I tend to get distracted easily.
Okay. It's best to be in a brightly lit room, which we've already talked about, and minimize the distractions by turning off the TV, closing the door, making sure you're in a quiet area.
Yeah, I usually do have the TV on, so I'll make sure I turn it off. Can you tell me a little bit more about heparin? Even though Dr. Chang has already been in here, I'm still just a little confused.
Okay, well, heparin is a drug that keeps your blood from clotting, but it does not dissolve the clots that are already formed. Because of your age, your kidney and liver function is decreased, so it's important to keep your appointments for lab work specifically to look at your platelets and everything like that, but you don't really need to worry about that. Just to make sure the drug isn't building up at a toxic level. So do you think you'll be able to keep those appointments?
Yeah, thank you for explaining that in terms I understand. That makes much more sense. Can you now take me step by step through this process? I want to make sure I do this perfectly while I'm at home.
Okay, well first you need to gather your supplies, which are the alcohol wipes, the injection site diagram, because I know it's hard, for you to remember stuff. I know it's hard for me. So you're just going to mark on that where your last injection was so you don't keep going over the same spot. Container for sharps, and then your pre-filled cartridge of heparin with a needle attached. It's important to check that it's the right dose and it's not expired, so you're going to check that on the packaging. And to wash your hands, and now we're going to practice, and we're going to pretend this pen is a pre-filled syringe.
Okay.
Now I'm going to show you, you can demonstrate it back to me when I'm done.
Okay.
First I'm going to choose the location on my abdomen. It needs to be at least 2 inches away from my umbiscus or my belly button.
Oh, okay. So it's not just anywhere, it has to be in a certain spot.
Yes, it has to be on your abdomen, but you also want to avoid sites that are tender, bruised, any scarring.
Okay.
Now you're going to take your alcohol wipe. You're going to clean in a circular motion all the way out. You need to let that dry.
So the skin should not be wet while I inject.
No, ma'am.
Oh, okay.
And now wait for, and then it should be, because of your age, you don't have a lot of low cushion there.
Mm-hmm.
It should be at a 45-degree angle. So you're going to inject it in, let go of the skin, and then take it out. There's a needle safety. You can put the safety in and then straight into the container for the sharps, excuse me. And do not massage the site.
So no massaging. Is there anything else I can do if it keeps bleeding?
You can apply gentle pressure with like a little cotton ball.
Okay.
Okay?
All right.
And then you would also document it on your diagram. Do you have any questions?
No, I think I got it. But just to make sure, first I wash my hands, and then I gather all my supplies, which are maybe some alcohol wipes, a pre-filled needle, a container for my sharps, and maybe some tissues in case I bleed. Then I want to make sure I have adequate lighting, and try to avoid my environmental distractions like turning off the television. After choosing my site for injection, I'll go with the abdomen.
Okay.
I'm going to pinch the inner, the outer, away from the belly button. All right, and then I'm going to clean the site from inner to outer.
Very good.
And then I'm going to make sure that dries. All right. And then I'm going to pinch, which I've already done, and I'm going to inject the needle at 45 degrees.
Okay.
All right, and then we're going to release the skin and pull the needle out at the same angle. Then I'll apply some pressure in case bleeding, but I never massage.
Very good.
All right, now that this is still out, I'm going to put this into the sharp spin.
Perfect. Don't want those grandbabies getting a hold of those needles.
That's right. Is there anything else I should know, Nurse Emily?
Well, if you have an overdose, protamine sulfate is the antidote.
Oh.
Make sure you avoid any other blood thinners while taking this. That's including aspirin. Could you repeat any of the safety measures?
Yeah, I feel like safety measures would be making sure my hands are clean,
Yes,
so washing them. Avoid activity that may cause bleeding,
Okay.
and since of my older age, I want to make sure that the environment is free so I don't fall. And then I want to make sure that all the needles are placed into the sharp spin.
Okay. Could you also tell me why it's important to keep your lab appointments?
Well, I want to make sure that my platelet and creatinine levels are where they need to be, so I don't have to worry about that in the future.
Right, and it doesn't build up in your system.
Yes, ma'am.
Excellent. Do you have any other questions for me?
No, I think that's it. I feel very comfortable now. Thank you for taking the time to explain this to me.
You're welcome.
Woo. All right.